Go.
Help him! Help him! Go, doctor!
Oh, I'm supposed to be like, help!
Always use proper
Come on! Stop laughing and help me.
Okay.
What kind of a doctor are you anyway?
This is ridiculous. I'm dying.
Apply pressure, even if it's a take off your shirt and put pressure on it if you need to. Anything.
Yes. So use your shirt.
Do I use that?
Yeah, anything. He's gonna bleed to death. Let's go.
Can't you see, woman? Yeah, sanitized.
Done. Feel better.
You are a terrible, terrible nurse. See? It's coming off. Bitch.
Divert the person's attention away from anything that might be harmful to himself or herself or to others. Try to shift the person's thinking from destructive to protect acts, from antagonism to
Oh my god! Get off her! Maria, get on your back. Stabilize your back. Maria, you alright?
Shut up, you ass!
Alright, you're good. Well, let's read what to do. Let's read what to do. Read what to do.
That's what we gotta do. Why'd you do that anyway? Poison
I didn't
ivy,
mean to.
Poison ivy yolk and sumac.
I tripped.
Hit me in the head,
Nosebleeds.
Oh, my knee really hurts.
Most important, you gotta take steps to ensure the personal safety of your others and the safety of
I
your area.
can't take any steps. My knee hurts.
Alright, I'm a doctor. What do I do?
If the person is in danger of harming himself, call the police immediately.
I don't have a phone. What do I do now?
Way to come prepared.
Go to the next
Treat the
step.
person
Way to
with
come
respect, no
prepared,
matter how he treats you.
It's okay. It's alright.
Consider all threats by a disturbed person as serious. You need to
Well,
take
I'm
all
sitting
threats
here.
serious from the patient, no
All right.
matter what.
Alright.
Ow!
Hell yeah. Now you won't press
Divert the
charges.
person's attention away from anything that might be harmful to him or herself, like you just did. Do it again. Try to shift the person's thinking from destructive to protective acts, from antagonism to cooperation.
Don't touch your knee. Broken.
Then help it.
Do not attempt to restrain the person physically unless he or she seems likely to injure herself. That's about it.
There's nothing. She's okay now?
That's all you can do.
Sprains and strains. First aid for sprains and strains includes rest, ice, compression, and elevation, also known as RICE. Treat the injury as a fracture if there is any doubt that is not only a sprain or a strain. Treatment. Rest the injured part of the body. Apply cold packs or cold compresses for up to 10 to 15 minutes at a time every few hours for the first 2 days to prevent swelling. Wearing an elastic compression bandage for at least 2 days will reduce swelling. Keep the injured part elevated above the level of the heart as much as possible to reduce swelling. Do not apply heat in any form for at least 24 hours. Heat increases swelling and pain. As you can see, Rich is now resting his ankle. We're now going to ice it.
Ice his ankle.
We're going to ice and elevate. Compress it.
Whip it around.
Dude, that could have been so dangerous right there. You really could have killed her.
Oh, I think my foot is broken.
It was a mistake, all right?
If your child has an open break where the bone protrudes through the skin and there is severe bleeding, apply pressure on the bleeding area with a gauze pad or a clean piece of clothing or other material. Do not wash the wound or try to push back any part of the bone that may be sticking out.
Broken bones, sprains, and strains. If your child has difficulty moving the injured part, or if the injured part moves in an unnatural way or is very painful to touch. Sprains and strains generally cause swelling and pain, and there may be bruises around the injured area. If the injury involves your child's neck or back, do not move him unless the child is in imminent danger. Movement can cause serious damage.
First-degree burns, the mildest of the three, are limited to First-degree burns, the mildest of the three, are limited to the top layer of skin. Signs and symptoms. These burns produce redness, pain, and minor swelling. The skin is dry without blisters. Second-degree burns. Second-degree burns are more serious and involve the skin layers beneath the top layer. Signs and symptoms. These burns produce blisters, severe pain, and redness. Third-degree burns are the most serious type of burn and involve all the layers of the skin and underlying tissue. Signs and symptoms. The surface appears dry and can look waxy white, leathery, brown, or tan.
You need to put that down.
I don't know what to do.
That's awesome.
The first priority in situations where there is an open wound is to stop the bleeding. Take a clean dressing from a first aid box or any clean cloth available and put it firmly in a place over the wound. The dressing should be kept in place or made thicker depending on how bad the wound is. A seriously injured person should never be moved from his position. This is to ensure any internal issues are not made worse. We're calling 911.
Oh, good. Yeah. Fuck. Fuck you, Cody.
Able to administer effective first aid does not simply involve having a first aid kit on hand. Effective first aid also involves having the appropriate skills as well as good judgment and the ability to keep a clear head while confronted with a medical emergency.
You put the hat on. You're on your tiptoes right now.
Put it on.
I say you put it on.
You have the red shorts on.
Choke yourself. I'm here to help, though.
Hi, Mike.
Hey, what's up?
And for when you get burnt like a lobster, always use protective sunscreen.
No, I'm burning Nikki.
You're not
Okay.
burning me.
Set her hair on fire.
That's real flammable.
I can read it.
Hot water and liquids are some of the most common childhood accidents. Some minor burns aren't cause for... You don't stop!
Really wants to burn her head.
Not kidding! Burn one of them!
Keep going.
Burn
Some
one of
minor
them
burns
people.
aren't... Mike, shut up!